Hi, it's Christina Wing on behalf of the American Society of Retina Specialists. I'm reporting from the annual meeting here in Chicago. I'm here today with Dr. Hani Salehi of Atlantis Eyecare in Huntington Beach, California. Dr. Salehi is here talking about anti-VEGF injections and the risk of tractional retinal detachment in eyes with proliferative diabetic retinopathy, a pooled analysis of 5 DRCR retina network trials. Dr. Salehi, thanks so much for joining us.
Absolutely, thanks for having me.
We appreciate your time. Great topic. With studies such as Protocol S and others, I think that more and more anti-VEGF injections are being used for the treatment of proliferative diabetic retinopathy. And of course, millions are given each year for diabetic macular edema in the setting of PDR. So we're excited to hear what you and your investigators found in this study.
Sure.
Tell us a little bit about the study design. Which 5 trials exactly were pooled from the DRCR network?
Sure. No, I think this is a very important topic. I'm glad we're discussing this. We wanted to look at a pooled analysis of everybody that had proliferative diabetic retinopathy with the available data sets in the DRCR network. So we looked at protocol I, J, N, S, and T. We looked at patients that have proliferative disease in these trials who were receiving anti-VEGF therapy. Like you mentioned, Christina, since the whole anti-VEGF therapy started, from the very beginning there was evidence that it causes regression of the neovascularization. So the question was always there, where what will happen with the regression? Is there a risk for progression of tractional retinal detachment? And there were some studies that came out and looked at case reviews and found that for patients that were planned to have vitrectomy, with the regression of the neovascularization, you had some progression of tractional retinal detachment. But these studies were always looking at patients that received anti-VEGF therapy, and they weren't looking at patients that did not. So the question was always there, is this the progression of the diabetic retinopathy, regardless of the anti-VEGF, that's causing this tractional retinal detachment, or is the treatment with anti-VEGF actually accelerating this progression and causing the tractional retinal detachment? So in this pooled analysis, what we did, in all the trials, you could enroll patients with proliferative diabetic retinopathy that did not have a need to go to immediate vitrectomy. So you couldn't enroll patients with proliferative disease that needed vitrectomy, and neither could you enroll patients that had macula involving tractional retinal detachment. So in this subset of patients, we looked at it to see if there was an increased risk with treatment.
And tell us what you found. Was there a suggestion that there was an increased rate of TRD formation?
So no, there wasn't. And again, it's very important to see what we're looking at. So for patients with active or patients with treated proliferative diabetic retinopathy, regardless of pre-existing TRD. So if they had pre-existing TRD or if they did not have pre-existing TRD, we did not find an increased risk of progression to tractional retinal detachment, and we did not find an increased need for vitrectomy for tractional retinal detachment. In fact, the rates were in the controlled arm, which did not receive anti-VEGF therapy. The rate was 6.8% for progression to TRD or worsening of TRD in the first year. And we only looked at the first year. And this rate was 4.8% for patients that did receive it. So there was a slightly lower rates. And the same was true for vitrectomy. So the rate was about 4.4% in the control arm and about 2.2% in the anti-VEGF arm. So suggesting that maybe there is a decreased risk actually with treatment. However, none of this difference was clinically significant. So regardless, it doesn't seem to cause an increased risk. We know that.
Thank you. And I want to touch on one point that you did mention earlier, and that is that the study did include patients with tractional retinal detachments that did not seem to warrant surgical intervention and did not involve the macula. Does your choice between PRP versus anti-VEGF therapy change if you're faced with a patient with PDR who has tractional membranes which threaten the macula?
Yeah, I mean, I think that's a great question, and I think it's something to emphasize is that we cannot answer that question based on the available data. We know that it does not increase risk of progression of TRD or the start of the TRD in patients with active proliferative disease or with treated proliferative disease that don't have macular threatening retinal detachments. But we cannot say for sure if that other subgroup has an increased risk. And that may be true, but again, like I said, the studies that previously have looked at it never had a control arm looking at not doing it with an anti-VEGF therapy. So does it change my approach to treating TRDs with membranes threatening the macula? I can't say that it does based on the available data.
Well, thank you so much. We sure do appreciate your time and expertise, Dr. Salehi.
Thank you for having me.
And this is Christina Wang reporting for ASRS Updates from the Field.